Masks and hoop earrings don't work well. Thank you, Mr. President, for your leadership. And let me take a moment to give some context for today's announcement. From day one, President Trump made it very clear that he wanted to make health care more affordable and accessible to every American. And the most important thing is that he wasn't afraid to take on the special interest groups to get this goal accomplished. And in the absence of any meaningful legislative support, this administration has delivered real, tangible results. Premiums down in Medicare by 34%, the lowest in 14 years, and some areas saw declines almost as much as 60%. We stabilized the exchange, lowering premiums for the first time, and brought back more plan choices. We have set forth a pathway to make the American healthcare system work more efficiently to deliver better quality and lower cost, tackling long-standing problems that no other administration had the guts to do. And the list is long. Price transparency so that patients know what they're getting charged before they get their care, portable digital health records so patients have their complete medical history right on their phones, reducing regulatory burden so that doctors can spend more time with patients. The healthcare system will work better because of what this administration and President Trump has accomplished. And as the President noted, our achievements on drug pricing are no less sweeping and unprecedented. Thanks to regulatory changes in 2017, the Part D premiums have dropped to some of the lowest rates in 7 years, saving beneficiaries over $1.9 billion in premiums. And we're also bringing price transparency to Medicare so that doctors and patients have pricing information when drugs are prescribed so that patients can get the best deal. The President's senior savings model has our Medicare beneficiaries cheering this year as they are selecting plans in this year's open enrollment. They have over 1,600 plans that are offering insulin for just $35 a month or less, and that is a massive 66% savings. Today's announcement is about Part B, where the Medicare program has been nothing but a powerless price taker. And the problem is simple. While there are market forces and negotiations that serve to reduce costs in other parts of the healthcare system, it just doesn't exist in Part B, which pays for drugs that you get in a doctor's office, cancer drugs and other infusions. In Part B, American seniors and taxpayers pay whatever drug companies want to charge. And doctors also get paid a percentage add-on. So the higher the drug costs, the more they get paid, giving an overt incentive to prescribe higher priced drugs and for manufacturers to increase its prices. And so it's no wonder that American seniors are paying twice as much as what other countries are paying. And because of this, over the past 5 years, Medicare spending for Part B drugs has gone up by 55% on average. And drug spending in Part B is responsible for over a third of the premiums that our seniors pay. So the bottom line is higher drug costs lead to higher premiums and higher copays. Doctors do well, drug companies do well, but patients pay more. This effort is going to save over $85 billion over 7 years and saving seniors over $28 billion as well. And so I want to thank the President for being a problem solver, willing to think big and to act boldly on behalf of the American patients. His record of success over the last 4 years is a testimony to that mentality. Thank you.
Thank you, sir. Thank you. Thank you. Thank you.